show our solidarity. Mary, M-A-R-Y, Warren, W-A-R-R-E-N, and I'm a community organizer with Organizing for America.
All right, so can you talk to us about the message that you want to send out by having this rally on the side?
Yes, we are sending the message that we think most Americans want healthcare reform now. We want real reform. We want reform that really changes things.
Anything specifically that you want to see changes?
We support the public option completely. We think that it has to be. Pardon me? Why is that? Well, because we need to get everyone insured, and we need to put pressure on the insurance companies. Because right now, most of our money is going to insurance companies rather than actual medical services. And so the way to cut costs is to get the insurance company piece out of the puzzle. And if you have a government-run insurance company, then that cuts overhead a whole lot. And that will make insurance more affordable. It will force the private insurance companies to lower their profits and focus on helping people get health care.
Kind of reversing the question, but a similar question. So what would this public option do in your opinion?
The public option would make insurance affordable for everyone, health care accessible for everyone, make the playing field fair. Because right now, if you have plenty of money and pre-existing conditions, you can't get health insurance, and that keeps you from getting health care. If you have no money, you can't buy health insurance, you can't get health care. So only those people who have the employer-sponsored insurance and haven't quit their job or been laid off have health insurance, or people who have never been sick and who have plenty of money. So right now we would like to expand that to everybody.
Have you been surprised by some of the scenes that you've seen in similar meetings and forums throughout America, and people kind of, you know, tempers flaring?
Yes.
What's your take on that?
Well, my take on that is, first of all, I am thrilled whenever any citizen is participating and expressing their opinion. I want citizens to participate. But secondly, I think that their message is somewhat garbled. There just seems to be a lot of anger and fear. There isn't a particular goal that they're trying to accomplish. It's just no to everything, and these people are going to ruin our country, but they don't really say how. I think it's just fear of change. I think a lot of it is people who currently have insurance and don't know the suffering and the obstacles that the rest of us are encountering. You know, if you haven't lived it, you may not think there's an urgent need for it. And so I always think education is going to enlighten everyone and get more and more supporters on our side.
How do you answer the people who are just coming in and shouting out and not letting discussions continue? There's no discussion. It seems to be what we're seeing is just a shout out.
It's important to have a discussion. I think if they do have ideas about what healthcare reform should be, then they should put those forward, and we should listen to it. Today, the forum inside is going to be very controlled, and we're going to learn a lot. It's going to be very educational. We've been trying to organize our own town halls around the city, where we bring in medical experts and so forth who come in and talk about what they know about the legislation, what they know about the need for reform, and let people ask questions and all. And I think that's a lot better. When it's just an anti-pep rally, then nobody learns anything. It just gets tempers flared. It just inflames everything. So I think it's better if we all stop and learn.
Are you going to be inside?
I'll be inside today. I did get a ticket. Yes.
Excited?
Very excited. Very excited. Part of history.
What are you hoping to hear or take away from it? I mean, are you open to kind of hearing both sides, or?
I am open to hearing both sides. I have heard Congressman Sessions speak already, and he didn't have anything that I felt was realistic. He was talking about health savings accounts. Well, if you can put enough money in a health savings account, you can have enough money to buy insurance. So he's not helping the people who need help. Lowering taxes is not going to be the thing that brings money to health care. And he said he would like to increase the number of insurance companies to increase competition. well, we've got plenty of insurance companies now, and competition does not seem to be making healthcare more affordable. But I will be very glad to listen, and I will pay full attention, and I will, I would be thrilled if I heard my congressman say something that truly represented my life experiences and what I need in my life. But so far it hasn't happened. Okay, thank you very much.
Okay, can I have your